Hello, everyone! Today I want to talk about something very important: breast cancer awareness, early detection, and screening guidelines. This information is extremely important because early detection can truly save lives and improve treatment outcomes significantly. What is early detection and why it matters? Breast cancer, when detected early, especially at stage 1, is often highly treatable. At this stage, the tumor is usually small, and in many cases, patients may require less aggressive treatment, sometimes even avoiding chemotherapy depending on further testing. The key message is simple: the earlier it is found, the better the outcome. Mammogram screening guidelines. For women at average risk, screening should begin at age 40. It is recommended to have a mammogram every year. Some guidelines suggest every 1-2 years, but annual screening is generally preferred for better protection. A mammogram is a quick imaging test that helps detect abnormalities in breast tissue before any symptoms appear. Yes, it may feel slightly uncomfortable for a few seconds, but it is very important for early diagnosis. Who is at higher risk? Some people may need earlier or more frequent screening. You are considered higher risk if you have a family history of breast cancer, especially in a mother or sister. You carry genetic mutations such as BRCA1 or BRCA2. You have had breast cancer in the past. You have received radiation therapy to the chest at a younger age. You have an estimated lifetime risk greater than 20%. In high-risk cases, doctors may recommend both mammogram and MRI screening, sometimes starting earlier than age 40. Understanding breast cancer types. Breast cancer is not one single disease. There are different types, such as invasive ductal carcinoma, invasive lobular carcinoma, DCIS, ductal carcinoma in situ. Each type behaves differently and requires a different treatment plan. Doctors also test tumors for markers like estrogen receptor (ER), progesterone receptor (PR), HER2 status. These markers help determine the best treatment approach. Treatment and next steps after diagnosis. After surgery, many patients may need additional treatment such as radiation therapy, often for a few weeks, hormonal therapy if the cancer is hormone receptor positive, sometimes chemotherapy depending on recurrence risk testing. In some cases, a special test like Oncotype DX is used to estimate the risk of cancer returning and to decide whether chemotherapy is necessary. Colorectal cancer screening, important reminder. Apart from breast cancer, another important screening is colorectal cancer screening, which should start at age 45 for average risk individuals. The gold standard test is colonoscopy, usually done every 10 years if results are normal. This test is important because it can detect and remove polyps before they turn into cancer. Please remember, your health should always be a priority. Do not delay your screenings. Do not ignore symptoms, and always discuss your personal risk with your doctor. Early detection is not just medical advice. It can be life-saving. Thank you for watching. Take care of yourself, because your health truly matters.